We're back, and as I told you, today is all about understanding and getting more education on COVID-19. Doc, before we took the commercial break, I was talking about how I was even in a cab and the driver had a mask on, and I was thinking, wow, this education is really going far. Now you're making me understand that it's the miseducation that is going far.
Yeah, you are right.
Yeah.
For me, as I've said, nobody should be putting on face masks, okay? I don't see who tells people to be doing that, okay? I don't know where it came from. But there's so much misinformation, and misinformation is very dangerous. Misinformation is very dangerous. So I would advise people to stay away from face masks, because as I said, the greatest fear, it gives you a false sense of security, okay? So you see someone, I even saw some today when I was driving to the studio, saw someone in an air-conditioned car, blasting music, is wearing face masks. It's actually not even using the one which we call the normal set. It's wearing what we want to use in case we have a confirmed case, which we call the N95. I don't know where he got it from. That's the one he has.
Wow.
And he's just wasting it.
In an air-conditioned
You are in an air-conditioned car alone, unless you are saying you don't trust your own breath. Because I don't see why you want to be wearing. If I'm in a car with people and I don't trust them, I'll rather open the window and let fresh air come through, and whatever cough may go out. Because you close and people are coughing in the car, whatever. I'm not saying it may be COVID, but it's better to be safe.
That's a good point you have made. You know, those of us in air-conditioned cars chilling with people in the car, it's even more dangerous.
Exactly.
You're keeping it inside.
Exactly.
Open the windows.
Exactly. Exactly. So once you have more than yourself, like you have others in the car,
open the windows.
Open the window is better now, because you never know. You never know. You never know. Yeah.
Oh, okay, okay. Solid point. There are so many myths, you know. I remember at the beginning, even I tweeted that does this thing affect Africans? You know, maybe when you are black, you are like immune. And there was this prevailing thing that under certain weather conditions, give us some education on that as well.
We don't have any data from WHO or CDC. CDC is Center for Disease Center for Disease Control. Yes, that's sorry. So if there's such an evidence, I would have said yes, it's true. But so far, there's no such evidence. And we are aware there are Ghanaians who have been infected, okay? So somebody can say, oh, but they got infected somewhere else. But they are Ghanaians, and they are black, like me and you. Unless they are not black. I can see I'm still black. My skin hasn't changed color yet. So we are still black. So it means that it's not something that affects certain type of races. Unlike sickle cell disease, that we know it affects blacks and people from Asia.
Yeah.
It's not like that. Or we know certain type of disease that is restricted to white people. It's not like that. So far, there's no evidence to suggest that it skips a particular race. So we should ignore them. They are all myths, okay? It's not true. What we know is that in the Western world, or even here, when the weather is cold, people tend to get more of common colds and other things, which is a norm. So people I think most people are linking that to this, but I don't think there's any bearing.
Okay.
There's no any bearing. So I think we should rather stay safe. Than believing all this
believing that you are immune because there's plenty of sun.
Which is even very dangerous.
Okay.
Yeah, which is very dangerous.
To hit you on the blind side.
Exactly.
Because you think you are okay.
Exactly.
So all these things, you know, and then initially, remember the whole thing about Chinese eating bats, and they eat all kinds of animals and things like that. What's your take on those?
WHO said that when a disease broke out in Wuhan province in China, they were able to isolate the virus from certain animals in the market. They have an animal market that were able to isolate the virus from it. So there's that link that it could be from some animal, okay? But what we know is that for coronavirus, with the MERS and the SARS, there was clear evidence that, let me use a term here, it's called zoonosis. That's infection.
What's the term again?
Zoonosis. So infection from animals to human beings. Okay, infection that stays in animals, then it jumps into a human being. It's called zoonosis, okay? So with MERS and SARS, it was clearly established. With COVID-19...
It was established that there was zoonosis?
Yes, there was zoonosis.
Oh, really?
Yes, including bats and other wild animals, camel and all sorts of things, okay? But with this, they've isolated the organisms. But research is still ongoing to confirm whether it is truly a zoonosis or not. If you purely use just the family of the coronavirus, you guess intelligence like, oh, it's possible, or it is it. But we need to wait for available data. Yeah, so we have to be careful. So the advice is stay away from wet animal markets. That's advice. So those of you who like going to animal markets, when it's wet, take extra precautions. If you can avoid.
We do you have animal markets in Ghana or something like Mayanka will be considered an animal market?
Maybe. Because we go to certain places in Accra and even Kumasi, they sell places that are fowl, even I think Sherman, cow and all. So I don't know whether those fits into the category, but God they say avoid markets. They actually added wet. So maybe what I'll say is that even if you are, I'm not saying don't go to a poultry farm, but I'm just saying we should just take precautions. I'm not saying we shouldn't go to a cow area. We should just take precautions because you will never know. These are all information and statistics, and we are still learning new things every day. Okay, and people have died, but so far globally it's about 3% of the people who have died. Okay, and people who have recovered, but it seems like people like negative news. So here I'm appealing to our media. I beg you, let's look on the good things and also propagate it. I mean, thank you for sending the information on preventive measures all over. Thank you very much. I salute you. Keep doing that. And also stress on the positive. People are recovering. Those who are even getting infected, they are recovering. And let me also say that
good recovery rate.
Yes, exactly. And also we've seen that from data that a disease, when children get it, they do well. When young adults get it, they do well. People who tend to die are people who are elderly, 60 plus, with chronic medical conditions. So people who are old with hypertension, diabetes, and all sort of diseases, kidney diseases, they tend to die. So you can imagine 40-year-old, 20-year-old walking about with marks. So somebody is not giving them the right information. Somebody, and I don't see why. I think the media earlier on, the information they were giving also caused fear and panic. So if everybody was running helter-skelter. So let's drum on the good aspects. Because if we prevent ourselves from getting an infection, even if there's infection, it will be contained. And when they recover, by the grace of God, we should all be fine. I'm hoping in the next few weeks, we should say all these people that have infected have recovered. And there's no more new case. So that we'll be happy. So let's avoid the negative reportage on COVID-19. Thank you.
And it's really true. There's a lot of negative reportage on it. And like I was saying, people don't understand. And in the process of thinking they are educating people, they are rather miseducating people. And that has led to, this. Because I think I was reading something that was talking about, even in Italy, the reason they have the highest amount is that most of them Italy is the country with the highest population of old age people. Exactly. So the people who have died were like in their 70 plus, and they had pre-existing conditions already. So that's very important for us to know. Well, I'm in that bracket too, but actually, never say die, man. So it's important to know that when you're young, you're active, let's not get hooked into that fear that you have got the virus and you're dying tomorrow. Work is being done. There's a lot of positive things going on with the research. What are some of the things we must know about this to know that there's a positive angle to it, that there's hope?
So there is a national surveillance in place. Yes, I always tell people that you never know that you are ready until you actually start doing something. So no country was ready till your system is tested. So our system has been tested. So far, the few cases that, I wouldn't say evaded, but when they got to their point of entry, they didn't meet the case definition. That later had the disease. They've all been followed up, And there's contact tracing ongoing, A lot of doctors, public health persons, and support from government is ongoing. It's not everything we tell the public. All they need to know is how to stay safe. For us, that's the most important thing for them to know. They should leave their work for us. At times, it's good the media highlights on, this border, they don't have this, and it's good for us because we can't be everywhere. So it's good. But there's a lot of good work going on. People are sitting on meetings, developing protocols. People are current with information from WHO to disseminate to all various facilities across the country. People are training health workers all over the country. These are people like me and you who probably are comfortable in Accra and Kumasi, but now because of this outbreak, they are all over. People are not sleeping. So there's a lot of work going on. And all these people are unsung heroes that you probably never hear of them. So kudos to all my colleagues out there doing great job for the country. God bless all of you.
It's so, I'm glad you're here today, you know, because it's so important, especially getting to the point where you say, once you get the disease and you recover, and then there are no reported new cases, it means you are making progress.
Exactly,
Yeah.
exactly.
So at what point do we get to where we say, well, now we are making some progress? Right now, as we're recording, we have 7 known cases. I'm very, very hopeful that all of them will recover.
Amen.
And hopefully get to the point where we are not getting new cases. The president came on air to announce some restrictions and bans, and said, at what point do we get to where, let's say, if we haven't heard of any new case, how long should we go not having heard of a new case before we can say that we are out of the woods? Let's.
The truth of the matter is that we can never say we are out of the woods till there's no more case anywhere. Because when we don't have cases anymore,
And there's
Nigeria doesn't have case anymore.
Okay.
All over Africa, we don't have any case anymore. China doesn't have any. China, their cases is dropping.
Yes.
They are not actually recording as high as.
Yeah.
So they are making progress. Okay, but it's not a one time or one day thing. It's a process. So till probably the whole world is free of COVID-19, because there will still be some restrictions in flights and other things. It will be ongoing for some time. I can't say that Ghana will say we are out of, but with time we'll see.
We'll see.
Remember SARS came?
Yeah.
There were a lot of issues, and so WHO at some stage will probably declare that, okay, we've won
the battle,
and there's no issue to worry about. So people can go about their normal activity. But remember the safety. So maybe the safety tips from this disease will become part of our way of life. Because if you look at some of the things they talk about, it's actually the civilized way to live. Because I don't see why you should just be coughing on people. I don't see why you should blow your nose in your hand and the next thing you are shaking somebody's hand. But people do that, unfortunately. So I don't want to say it's a blessing in disguise, because nobody wants to have sickness as a blessing. But it's teaching us a lot of things and to refine
a lot from
our way of living and what we call culture. We have to probably change some of our cultural behaviors. Okay. And one thing I want to add is that there's a lot. We talk about exercising, staying healthy, drink a lot of water, sleep well, avoid stress. So somebody say, how can we avoid stress in Ghana? The economy is hard and blah, 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 blah. Please avoid stress. There's a lot of stress. It's not only economic stress. Avoid stress. Get good sleep. If you think your stress is beyond some level, get help. Okay, I don't mean financial help. Get help. There are clinical psychologists can assist you. Okay, and in all these cases, I'm happy that we've made available clinical psychologists. So people who get infected are counseled, made comfortable, reassured, because these are all very important parts of our healthcare system, which all this is bringing up. It was done at some places, but not everywhere. But now it's coming up. So we are learning, and we'll get better with time.
So basically, what you're saying is that out of this tragedy or this disaster, we are learning
a lot
from what we can do with our lifestyles going forward. Okay. Wow. But Doc, before I let you go, you are with UGMC, and I know that you have started with some services and things that are related to everything that we're talking about. So you being the head man from UGMC, please tell us a little bit about your services and everything we need to know.
Okay. University of
and
Ghana
by the way, UGMC is the University of Ghana Medical Center, right? Okay.
So University of Ghana Medical Center has started operations. It's been done in phases, okay? So before I went there, they were running specialist OPDs, okay, by the family physicians. Now we've scaled up. Now, apart from the family medicine OPD services, we are running internal medicine services. We are running surgery, general surgery, OBGY, as in obs and gynae, pediatrics, and now emergency medicine. So we are open. So if you need any of these services in a more serene environment, where the patient is at the center of our care, there's no other place to come to in Ghana than UGMC.
Okay. So is there any way we can contact listeners, viewers can contact UGMC? If you can give us the phone number or the web, the address, the email, anything that will help us.
Okay. Before I give you the website and our phone numbers, let me just mention that Our pharmacy is running. Our laboratory services are also running, as well as our imaging. So X-ray, CT, ultrasound.
They're all running.
They're all running.
Okay.
So our website is www.ugemedicalcenter.org. I'll take it again. Our website is www.ugemedicalcenter.org. And our phone numbers, I only give one for now. Ghana code, Accra code, Ghana code, which is +233, Accra code, which is 302 for where we are, then 550843.
Okay.
You can go on the website and make a booking. You can also call this number and make a booking.
Okay.
And if you are close by Legon, you can always come around and have a look at the facility. So we'll be expecting you.
Fantastic, fantastic. And the numbers and the website is on your screen right now. And the good thing about it, those of you who are online savvy, you can make your bookings online right now and get an appointment to go and see. Or you can call the number that you see on the screen now. And as he said, if you live in Legon or around and you want to go there and check it out. I'm very, very glad to hear that the facility is open now and is actively active. Yeah, I should put it that way. Dr. Takyi, thank you so much for your time and for joining us today and the education you have given us. We really appreciate it. I would want to get into, not now, but eventually maybe you and the doctors who are practicing emergency medicine can come so we can do a whole show on that for people to understand this emergency medicine aspect, because I think it's very critical in these times. You know.
It will be a pleasure.
And you're a pioneer.
Yes.
How many doctors came out?
7. The pioneers were 7.
Oh, there are 7.
Yeah, two ladies and 5 gentlemen.
Oh.
Yeah.
Okay. And they're all...
The 6 out of the 7 are in Kumasi. I was the only one who went up north. Though they assisted me in a lot of my activities up north. I was the only one who went up north, and I'm now in Accra.
Oh, okay, great, great. Oh, I forgot. Before we leave, we have to ask, you're married with kids?
Yes, I'm married. I have a wonderful wife by name Yabema PJ. She's a nurse.
Oh, she's a nurse?
Yes. God has blessed us with 3 lovely kids.
Oh. Were you working in the same facility now?
Something like that.
Something like that. Something like that. Okay, there we go. Thank you so much. And folks, I hope you've heard everything. And please, the best thing, take care. Precautions are better than anything. For now, let's deal with that. Stick around and we'll be right back.
The KSM Show.